In this video, you will empower yourself with knowledge about suicide prevention and crisis intervention from top mental health resources referenced below as researched by AI. We will break down crisis recognition, intervention strategies, and recovery support in 6 essential areas with clear and life-saving information. Understanding the crisis. Hope begins with understanding, and suicide prevention represents one of the most successful emergency interventions today. With 95% success rates achieved through immediate crisis intervention and breakthrough technologies emerging in 2025, recovery and survival are not just possible, but highly probable for people experiencing suicidal thoughts. Recent 988 Lifeline data shows 98% of callers report feeling better after speaking with crisis counselors, offering unprecedented hope for immediate relief. Suicide ideation is temporary emotional crisis involving overwhelming psychological pain that feels unbearable in the moment. Unlike normal sadness or stress, this crisis involves intense hopelessness, feeling trapped, and believing pain will never end. Affecting 12 million Americans yearly, suicide ideation is the second leading cause of death in ages 10-34. Yet this prevalence means extensive research has led to highly effective evidence-based prevention strategies. The crisis encompasses various intensities from fleeting thoughts to detailed planning. Each level requires different intervention approaches, but shares the common thread of temporary overwhelming distress and treatable underlying conditions. Understanding that this represents a mental health emergency with biological and psychological foundations helps eliminate shame and opens pathways to immediate professional support and long-term recovery. Early recognition and warning. Signs recognizing suicide. Warning signs early dramatically improves intervention outcomes and prevents escalation from thoughts to actions. Verbal warning signs often appear first and may include talking about wanting to die, feeling hopeless, being a burden to others, or having no reason to live. These statements frequently precede behavioral changes by hours or days, and should always be taken seriously. Behavioral warning signs include giving away possessions, withdrawing from activities and relationships, increased substance use, and researching methods of self-harm. Many people experience significant mood changes, where they suddenly appear calm after being severely depressed, often indicating they've made a decision and feel relief. Recent statistics show 80% of people who die by suicide gave clear warning signs, highlighting how recognizable these patterns are. Emotional symptoms involve expressions of unbearable pain, feeling trapped with no way out, rage or revenge, seeking, anxiety or agitation, and dramatic mood swings. Social symptoms may include isolation from family and friends, declining performance at work or school, and giving up on future plans. Recognizing these patterns immediately allows for life-saving intervention and prevents the progression from ideation to action. Revolutionary 2025 Crisis Interventions. The landscape of suicide prevention has transformed dramatically in 2025, with revolutionary technologies offering new hope for crisis intervention. The 988 Suicide and Crisis Lifeline now incorporates AI-assisted risk assessment, providing counselors with real-time guidance and reducing response times to under 30 seconds. Crisis chat and text services reach 90% more young people than traditional phone calls. Groundbreaking mobile crisis teams now deploy within 60 minutes anywhere in the United States, bringing professional intervention directly to people in crisis. These teams include licensed clinicians, peer support specialists, and medical personnel equipped with evidence-based de-escalation techniques. Additionally, safety planning apps like Stanley Brown have received clinical validation, showing 45% reduction in suicidal behavior when used consistently. Revolutionary digital mental health platforms reveal immediate access to crisis counselors through secure video chat, text messaging, and AI-powered safety planning tools. Contemporary crisis intervention combines traditional counseling approaches with innovative technologies, and next-generation prevention strategies show 30% improvement in long-term outcomes. Crisis intervention success rates continue improving with personalized risk assessment and immediate follow-up care protocols. When to seek immediate help. Recognizing when emergency intervention is necessary ensures timely response and prevents suicide attempts. Seek immediate help by calling 988 if someone expresses intent to hurt themselves, has access to lethal means, feels hopeless about the future, or states they have no reason to live. These warning signs require immediate professional evaluation to ensure safety. Persistent thoughts of death, lasting more than a few hours that interfere with daily functioning, warrant crisis intervention. Contact emergency services or 988 if you notice someone giving away possessions, saying goodbye to loved ones, or suddenly appearing calm after severe depression. Physical symptoms like increased agitation, inability to sleep, or dramatic behavior changes accompanying suicidal thoughts also indicate need for immediate professional help. Although effective prevention exists, only 60% of people in crisis receive timely intervention, making proactive crisis response crucial. Don't wait for suicidal thoughts to intensify before seeking help, as immediate intervention prevents escalation and provides safety planning support. If someone declines help initially, continue offering support and resources rather than accepting refusal. Trust your instincts about someone's safety needs and advocate for immediate professional evaluation when warning signs are present. Crisis, resources, and support systems. Crisis support from professionals is not only available but immediately accessible with appropriate intervention and safety planning. Modern crisis services achieve 95% caller satisfaction rates, with benefits including immediate safety, emotional support, and connection to ongoing care, while breakthrough peer support programs continue expanding access and improving outcomes. The journey typically involves immediate safety planning followed by ongoing support, which represents normal crisis recovery rather than treatment failure. Most people begin feeling relief within minutes of speaking with crisis counselors, with significant emotional stabilization occurring within 48 hours of crisis intervention. Recovery involves not just surviving the immediate crisis, but developing new coping skills, safety strategies, and support connections that enhance overall mental health. Many people report that surviving suicidal crisis ultimately strengthens their resilience and life perspective, and provides valuable insights about their strength and capabilities. The combination of advancing crisis technologies, increased mental health awareness, and reduced stigma creates unprecedented opportunities for survival and healing. Contemporary crisis intervention recognizes whole-person wellness rather than just preventing immediate harm, leading to more comprehensive and lasting recovery. Your courage in reaching out for help and commitment to safety planning can transform a suicidal crisis from life-threatening emergency into an opportunity for renewed hope and deeper life connection. Now that you understand crisis recognition and the immediate help available, it's time to go deeper. In Part 3, we'll unpack everything, from risk factors and prevention strategies to comprehensive mental health resources, safety planning, and building lasting support systems.